These are the UK's air ambulances.
17-year-old been hit by a car and is unconscious.
Elite teams taking to the skies at speeds of 190 miles per hour.
Aircraft at Angley 1 listing.
Got an ETA of 9 minutes.
Specialist pilots, paramedics and doctors
Jack, we're just putting you off to sleep now, OK, buddy?
bring A&E to the roadside
He's got a partial amputation of his forearm.
and countryside.
Life can change in an instant.
Every day is completely unique.
With exclusive access.
No.
Our cameras follow 5 teams across the UK.
As we arrive on scene, there's always a little bit of adrenaline.
When you've got severe traumatic injuries, every minute counts.
Racing against the clock.
You must go sideways, do not go forward.
Bringing cutting-edge equipment
Can I have some suction, please?
and surgical skills
Tubes through the cords.
to the most critically ill patients.
Don't leave me, darling.
We've taken over his breathing for him.
You can genuinely make a difference.
I have to pinch myself sometimes that my office is a helicopter.
There is no catering today, but there is witty banter and drugs to keep you comfortable.
Oh, that's service with a smile.
Flying from their base on the edge of Epping Forest, Essex and Hert's Air Ambulance respond to around 200 incidents a month throughout Essex and Hertfordshire. On the early shift is Dr. Seb Clark.
Right. So I've worked in emergency medicine for the last 8 years, and I've been working for Essex and Hert's for the last 4 months. So I'm still finding my feet a bit and learning how to pack the helicopter.
You happy if I put the ultrasound in the front, mate? Yes, mate, totally.
Working alongside Seb is critical care paramedic Jay Samuel.
I've got everyone's favourite chicken curry for breakfast today. Yeah.
Working with Jay is great. He's a really experienced paramedic, and he's been working for Essex and Hert's for a very long time. Jay's excellent dealing with patients and families in distress. He's very open and honest and very reassuring. So I know that he'll keep me right.
2 pressure bags. Perfect. And everything's sealed. Sweet. Coming in.
Morning checks complete. The crew are ready to deploy to critical incidents throughout the region.
Five, go ahead.
Hello, can I talk to you in Hitchin, please? Cardiac arrest, 57-year-old male.
5 on route.
Cheers, mate.
Deployed to a patient in cardiac arrest, the crew will be airborne in under 5 minutes.
Doors and harnesses.
8 o'clock left.
8 o'clock front right.
We're 7 o'clock in the rear. There's a spot clear left. Lifting.
They're heading 42 miles northeast to a village in Suffolk.
Traffic 5 miles, 400 foot below, 100 foot above.
But a few minutes into their flight,
Echo Alpha, Hemet 55.
You cancel.
the critical care desk divert the crew to another incident.
What are we going to? RTC, child, now in cardiac arrest.
It's an 8-minute flight in the opposite direction.
A lot of emotion goes through my mind when I get a job like this. As a father myself, seeing critically ill and injured children is one of the hardest parts of the job. If he's in cardiac arrest, that means his heart isn't pumping blood around the body. Without quick intervention, it could be fatal.
Right, guys, he's going to come down the left-hand side. Echo Alpha, Hemet. Right, it's right on the edge of town.
So here we are, there's the scene there. Okay, so I think probably the best area is literally this big park area behind us.
So this one here.
It's very, very slopey. Up here, probably the flattest part. I'm happy there.
Lovely flying, Ollie.
Brakes are on. Tail's all good. Everything's clear.
With no time to wait for the helicopter to shut down,
Hey, guys, you must go sideways. Do not go forward.
Seb and Jay duck clear of the running rotors.
Take that one.
A waiting police van takes them to scene,
It's just what he's got there.
where the land crew are with the patient.
So you got mid-T, he's bullseyed the windscreen as he's come through. He's got reduced sounds on the right-hand side of getting oxygen. He has got a rightwards gaze. He's also got quite a lot of lower limb injuries. That's as far as we've got with our assessment. TXA to go in.
14-year-old Jack was on his scooter when he collided with a Range Rover, hitting his head on the windscreen.
Aside from what Hannah's heard,
He isn't in cardiac arrest, but is critically ill.
That's right. Can we start getting him onto our monitor, please? Yeah, that's cool.
Okay. And you thought you found reducer?
Do you want a little bit of kit so we can sort this airway out?
Yeah, very good idea.
Jack's head has taken the full force of the impact from the car. He is unconscious and has multiple injuries that are critical.
TXA? Is that right, yeah? 1 gram, please. So that's tenting, isn't it? Bit of grazing there, and he's got a closed tib fib fracture here, which I want box splint, pelvic binder, big boggy swelling on the right side of his head. Obviously, his GCS is E1, V2, M2, so 5.
We assess a patient's responsiveness using a scoring system. GCS 5 means that Jack is unconscious and is suffering an acute traumatic brain injury.
I sort of appreciate what you mean, but I think it just varies with his respiratory effort.
When the brainstem is damaged, the body can lose control of vital functions such as breathing.
We're going to do an RSI, and we'll take him to London. Is that okay?
An RSI is a procedure used to take over a patient's breathing and is usually carried out by a team of medics in hospital. But Jay and Seb are specially trained and will perform Jack's RSI at the roadside.
Right, if you can keep his head straight. Just push his jaw forward a little bit. Like that. Mate, do you want to suit up and then take over his airway? Because he's really...
Is he struggling now, yeah?
Snoring.
All right, mate.
Jack's snoring at this point because he's so unconscious that he's lost some of the muscle tone and his tongue's falling back into his throat, blocking off his airway.
Have we got any details on next to kin or anything yet?
The more Jack's body's starved of oxygen at this stage, irreversible damage will happen to his brain cells and they'll start to die.
Yeah, so he's definitely fitting here. So I think we should prep some levetiracetam as well, okay? I'm thinking a 1-2-2.
It's Kit and Rock.
We need to take over Jack's breathing for him as soon as we can and make sure we're getting enough oxygen to his brain.
He's only turning around.
Yeah, I'm happy with the positioning, yeah. Jack, we're just putting you off to sleep now, okay, buddy?
5, 6, 7, 8, 9, 10 mils, 100 milligrams of ketamine.
A powerful combination of the drugs ketamine, rocuronium and midazolam will paralyze Jack and stop him from breathing.
Oxygen coming away.
The crew have only a few minutes before he runs out of oxygen.
A bit of blood, can I have some suction, please?
Yeah.
Grade 1 butte.
There's a boot.
Going through the cords.
Are you happy for the tube?
Tube, please.
A breathing tube is inserted between Jack's vocal cords and into the trachea.
Up to the... Yeah, chest rise.
I've got colour change. I've got waveform coming up.
Happy for me to come out?
Yeah, and I've got an end total of 6.7.
Lovely.
The crew are now in control of Jack's breathing.
Brain injuries like the one Jack's just sustained can rapidly evolve, so we need to get him to a neurosurgeon at a major trauma centre as soon as we can.
If we could have some head blocks ready, that'd be great.
Jack was alone and unconscious when he was found, but police have now traced his mum.
Tube 5-6.
VTA is less than 10 minutes. We're not going to wait here for her. Yeah. But she can meet us at the helicopter. Okay.
Right.
Jack is taken to a land ambulance to travel the short distance to the helicopter.
Good catch.
Good. That should be okay there, I think. Perfect. Go for it.
As the ambulance pulls up, Jack's mum, Caroline, arrives.
We popped him off to sleep, so we've taken over his breathing for him, and we're managing him and giving the drugs to look after him. He's seriously unwell. We think he's predominantly got an injury to his head.
Having to tell a mum a child is seriously ill is absolutely horrendous, but it's an important part of the job.
And if you want, you can hold his hand while we're carrying him over. All right, so go to the left-hand side of the aircraft, guys.
As much as it upsets me, I have to be honest with her and let her know Jack's condition, but I also need to reassure her that we are doing absolutely everything we can for him and that we are taking him to the place that will give him the best chance for a good outcome.
Come and give him a kiss and say, see you later. And by saying see you later, all you mean is I'll see you in about half hour, 40 minutes. These guys know what they're doing. They'll get you to the hospital. And by that time, he'll probably be coming out the scanner, OK? But I promise we will look after him. If you go with these guys now, we're going to get out of here.
Look at me, those. Have you going this way? You start off.
Yeah, go for it.
I'm starting for you.
Yeah. Top up drugs. Let's go. Madaz with Fent.
Yeah.
Okay, parking brake.
Right, you guys all good? We're good to go. All good. Clear left.
The major trauma centre at the Royal London Hospital is 25 miles away.
Constantly monitoring Jack throughout the flight until we get to hospital, looking for any slight changes that we can respond to immediately.
Just 5 minutes into the flight, Jay spots something.
I noticed that Jack's starting to tear. This tells us his sedation's starting to wear off. We need to very quickly give him more sedation.
The crew of Helimed 55 are flying 14-year-old Jack to the Royal London Hospital. He has a severe brain injury and is in an induced coma. But the crew notice Jack's eyes have started to tear up.
This tells us Jack's starting to wake up, and this is the last thing we want him to do while we've got a breathing tube in for him.
45 minutes since Jack was sedated, Jay quickly administers more meds to keep him under. It's a 25-mile flight to the hospital. But as they fly into London, they hit an area of congested airspace.
Traffic. Traffic.
He's going away from us.
Really busy. Wait a second.
No, I was trying to tell you about an aircraft that was coming really close to us. That was all.
Yeah, so we got them all. It's really busy.
Yeah.
Stand by.
Pilots Lee and Ollie must find a route through.
The skill of the pilots that we work with is they don't let the pressure of what's going on in the back of the aircraft get to them, and they concentrate on getting us to the hospital as safely and quickly as they can.
It's just 11 minutes since takeoff, and despite the traffic, the crew approach the hospital helipad.
Landing gear.
Down up 3 green. And landing on.
Forward, forward. All the way, all the way, all the way, all the way.
At this point, we don't know whether Jack will wake up or what his long-term outcome will be. We've done everything that we can to give him the best chance.
Is that far enough, or do you think a bit more?
Jack will now have a full body scan and will be seen by a neurosurgeon. RAF Benson, nestled on the edge of the Chiltern Hills, home to the Thames Valley Air Ambulance. From here, critical care teams are deployed to help patients through Berkshire, Oxfordshire, and Buckinghamshire. It's early morning, and the helicopter is not yet online, but Dr. Zulfi Ahmed and paramedic Katie Schofield are already en route to a job.
They are in Bicester,
Yeah, they should just scoop and run.
The call came in just before 8 o'clock. We were going through our checks. We weren't fully online. The car was ready, so we decided the fastest way to get there would have been by car.
49-year-old needing cardioversion.
A land crew have requested their help with a patient who has a dangerously fast heart rhythm. En route, they receive an update on her condition.
Still the same, still have a multiple blood pressure. Situation still the same. Blood pressure still unrecordable.
Yeah.
SB2 at 200.
The patient's heart is beating at 200 beats per minute.
At that rate, the heart isn't working properly. The longer the heart rate stays very high, the more likely the heart will start dying off and she can have a cardiac arrest.
Should we park there? Get the adenosine out. Not to crack anything open.
Let's get the stuff out.
We'll need suction as well, won't we? And we'll need drag.
The longer it takes for us to reduce her heart rate, the likelihood of her heart stopping increases. These situations can get quite stressful, and the best way to reduce your own stress levels is by having everything ready.
Hiya. All right, hi. Okay.
Oh, we've got Demi. Demi is 49. Today, woke up about 7:45, palpitations, shortness of breath,
Yeah.
episode of vomiting. And on arrival, heart rate much as you see it now. We've tried cannulation 4 times.
Yeah.
Okay.
No luck with that. Last blood pressure was a manual and got systolic around 80.
Demi has a history of heart problems in her family and lost her 53-year-old brother to heart failure less than a year ago.
Sudden cardiac death in the family, a history of enlarged aortas in the family too. And Demi is under cardiology for investigations into her aorta.
So what we're going to do, we're just going to pop our monitor on you as well. I know you've got loads of stuff on you already.
Zulfi wants to administer IV drugs via a thin plastic tube called a cannula, which will be inserted into one of Demi's veins.
Okay, it's going to be a bit of an uncomfortable place. I do apologise.
But first, Zulfi needs to find a vein.
Close, open, close. Okay, there's on that. Your heart's not beating properly. It's not going round, and therefore it's harder to get the cannulas in. Really? You're supposed to tell me that after I get it in, not before, huh?
The land crew have already tried 4 times without success.
Someone's been there before.
Pain.
She is in a shocked situation, which means her blood pressure is not enough to supply oxygen to the rest of her body.
Pop that arm up for me just for a second. Okay, there we are. Thank you.
Part of being shocked is that your peripheral vasculature can shut down, and that can mean that it's harder to get the needle into the vein because the veins disappear.
Okay, it looks like we might be getting one. Okay, a bit of pressure again. You ready? 1, 2, 3.
But the cannulation fails once again.
Oh, you're not going to be fun today, are you, eh?
I test you.
Now you're testing me.
Zulfi looks for a vein in Demi's arm.
Can you just squeeze there for me?
I asked Demi to pump her hand to try and get blood into that limb, and that will allow the veins to be bigger for me to cannulate her.
Open, close again for me.
And this time,
Done.
Let's see if that's in.
the cannula goes in.
Good. All right, so we're getting there. Phase 1 complete, as they say.
Now that we have IV access, it means that I can give the drugs that I need to straight into the cannula.
You all right? We're here to help. Yeah? We will look after you.
Don't take.
You're going to be fine. Like I said.
I've lost my auntie
I know.
in the fires. 5 days. But
Well, more of a reason for you to carry on then, isn't there? You're going to be fine. You're going to be good.
Demi's been through quite a few different traumas. This can have an effect on her heart, and it's important for us to understand that that could be one of the reasons why her heart rate is so high.
Do you want me to give you something to make you feel a bit more relaxed? Okay, let's do that first.
Should we get going?
Let's give some Madaz first, I think.
The Madaz is here.
yeah.
And this is 10 in 10?
Zulfi uses the cannula to administer midazolam, a sedative which will reduce Demi's pain and anxiety.
This is just to make you feel more relaxed, okay? Not that I advocate drinking, but it's like you've had a couple too many. Let's get you through this, all right?
What's your name?
Zulfi,
Very nice name.
thank you.
Have you got children?
I have 3 daughters.
How old are they?
The oldest is 18, and the youngest is 12.
Demi's clearly anxious. She's worried about a lot of things. It's human nature to try and calm people down by speaking about what interests them and interests you.
How old are your children?
14 and 12.
Who's with them? Hubby?
With Demi a lot calmer, Zulfi prepares to administer a drug called adenosine, which blocks the electrical signals in the heart.
So guys, has anyone seen adenosine before?
I haven't, no.
Okay. So they feel really weird, and then they say, I feel strange. The heart rate starts dropping, and then it comes back up again.
Sure.
Okay. We all happy?
But we're all here, okay?
Just going to give you...
He starts with a dose of 6 milligrams.
Okay, going in now. Just focus on that breathing, nice and slow. You're doing good. All the way in, all the way out. Well done. Okay, dropping. Good.
Within just a few moments of giving the adenosine, Demi's heart rate starts to drop.
It's just going to make you feel very funny.
Remember I told you it made you feel weird, yes? You can explain it to me afterwards. And I think my wife might not like that.
Come up, and we've got the line.
Demi's heart has slowed down,
Yeah.
but suddenly speeds up again.
Yeah.
Zulfi increases the dose.
Let's try for 12 next.
Yeah. Leave.
But Demi's heartbeat continues to race.
Well, that's back to 200.
If Demi's heart rate stays at 200, she may have a cardiac arrest, which now means we need to go to the next stage of our treatment.
Let's just pop up for 10 seconds.
Yep.
Zulfi and Katie discuss giving Demi's heart an electric shock.
So we shock and then take. That's 15 minutes for the heart doing better than it is now.
Yeah.
The only problem is if the shock doesn't work.
Well, we can shock 2-3 times. It's just more pain, I'm thinking, for her. But yeah, we can certainly give it a go.
We need to administer a shock using a defibrillator. The biggest risk of using a defibrillator is it can adjust the rhythm and push her into a cardiac arrest.
In Bicester, the crew of Helimed 24 are with 49-year-old Demi.
Red right.
They're going to administer an electric shock to her racing heart to try and get it back into a normal rhythm.
We're going to pass electricity through her heart. There is a possibility that it will stop, but that's okay. It's not going to happen. We just need to warn you that it might happen. No, it's not happened with me before, okay? We're going to have some other stuff nearby just in case, if that happens, all right? We've got all the drugs that we need to give you if anything doesn't happen according to my plan.
First, Zulfi gives Demi more pain relief.
Okay, you ready?
Oh, what do I feel?
So we're sleepy.
You're going to feel sleepy again?
Yeah.
You're going to have a little rest?
And then when I wake up?
Yeah.
It'll be all done, inshallah. It'll all be all right, okay? So 1 milligram midazolam now, can we mark?
Yeah, we can do, yeah.
Midazolam and propofol will send Demi into a light sedation.
You okay? Yes, yes. Only in a couple of minutes, not long now. Okay, 2 mils propofol only. Can we mark? Well done. Focus on that breathing.
Feeling a bit sleepy.
Okay, let's do it.
Katie will administer the shock to Demi's heart via electrode pads on her chest.
Okay, shocking. Everyone away, everyone clear.
It's all right. It's okay. We're okay. We're all here.
Well done, well done. You did really well.
How are you doing?
Demi's heart goes back into a normal rhythm.
Good news. You okay? I bet you're feeling better now.
You did really well.
Perfect.
It's always a relief to see that your patient's got better in front of you and you've administered the right treatment to make her feel better. So that's always a win.
You all right? Okay.
All right, we're going to pop you to hospital now, okay?
Happy days. Let's go.
With Demi stabilised, Zulfi and Katie will travel with her in the land ambulance to the John Radcliffe Hospital in Oxford. In the Midlands, the Derbyshire, Leicestershire and Rutland Air Ambulance delivers advanced medical care to a vast area from their base at the East Midlands Airport. It's Friday afternoon, and the crew are returning to base after their third incident of the day.
Go for it. 5-4 receiving.
They're retasked.
Yes, I saw further details for you.
I'll go over details. Whereabouts are we going?
Sierra Kilo 442 610.
That's all copied, and what's the nature of the detail?
Got a 10-year-old boy, all up my by car.
That's copied. Anything else on scene, over?
Negative at the moment, still taking details.
Yeah, Roger received. We've got ETA of approximately 10:10 minutes, over.
A young boy has collided with a car in a residential street in the mining village of Tipshelf. Flying to scene is today's duty doctor, Scott Knapp.
My day job is I'm a consultant in emergency medicine. This gives me an opportunity to bring those skills of the emergency department direct to the roadside. The flying aspect of the job is one of the most fun and interesting bits of the job, but that aircraft is just about getting us to the scene where we are needed.
2 minutes to run. Thank you. So you say we're going to be first on scene? We are going to be first on scene. Okay. So we're just looking for a crowd of people.
When there's no one medical with the patient at the time, every second really does count. We've heard that this is a 10-year-old boy, so I have my own 10-year-old at home, and actually I'd want any emergency services to get there as quick as they possibly can.
Seen out a small car park, red-sided house. Yes, seen. Crowd of people. Oh, yeah. So it's going to be playing fields, I think, guys. I think with what the job is, let's just get on the ground, eh? Yeah, get to that. You guys happy where you're going? Yeah. And then 5-4's landed on scene.
Working with Scott is critical care paramedic Martin Gorman.
That way up there, yeah?
Up those steps,
Cool.
and then we've got no information on injuries.
No. Left?
I think left.
On the blanket.
Do we can talk.
Thank you. Hello.
Hello, hello.
Hello, my name's Scott. One of the doctors.
Hello.
One of our paramedics. Who have we got here? Hello, Jack.
10-year-old Jack was out on his bike when he collided with a car and landed on his face.
We're in the best care, aren't we, darling?
His mum Rachel rushed out of a hairdresser's appointment to find him still lying on the road.
Okay. Hey, we're up.
Hey. Do you remember what happened? What happened? Do you remember? It's okay if you don't.
Been
That's
so
fine.
quick.
Not to worry. What were you doing?
On a bike.
You were on a bike, were you? Where's your bike?
His bike's here.
Bike's over there. Okay.
Bike's safe.
When we arrive on scene, we're taking a lot of information in. This is really going to determine how worried and concerned we are for a really significant injury that might be going on.
How's the rest of your chest and tummy? All feels all right? Yeah? All right if I squeeze it?
It's fine.
Feels okay? Not hurting it? Not making any pain? Oh, good man.
Smashing.
Excellent. So how old are you? Let's start with that question.
10.
You're 10. And when were you born? Do you remember what month you were born in?
When's your birthday?
When's your birthday?
That's an important day.
Yeah.
Isn't it?
That's okay.
That's okay.
That's fine. That's fine, not to worry. Do you remember what school you go to?
You all right?
Okay. Do you want to sit down? Sit down.
Sit down, my friend.
You're fine.
That's it,
Take
buddy.
your time.
Okay. Do you want to lean back on me, mate?
Yeah.
Okay.
Jack is struggling to recall this information. This indicates that he's probably got a degree of a brain injury. But we're particularly worried if there's the ongoing bleeding, because this could put pressure on his brain and means he could lose consciousness at any point.
Did you have a helmet on when you were on
He
your
hasn't
bike?
had a helmet on now. Have you had a helmet? I
No.
don't think you took your helmet out, did you? That's what I mean. I don't think you did.
I can't see it.
Take your helmet.
Helmets are designed to redistribute the amount of force that's felt by the head. In Jack's case, all that force would have been placed onto a single point of his skull, and that would have been transmitted into his brain.
Just open your mouth for me.
So,
Stick your tongue out.
You can hear it.
Yeah.
First incisor. Don't suppose it's kicking around, is it?
Closer inspection of Jack's mouth reveals he's lost a tooth.
If he's inhaled this tooth, then this could cause him significant complications in the future. It's also really useful for the dentist to know where the tooth is, because there's a chance that they might be able to reimplant this tooth or even use it to design him a new tooth.
Is there a tooth
There are
anywhere?
spots
May have gone
somewhere.
bouncing around.
When we stand about, is this exactly where he ended up?
That's not it over there, is it?
That could be, actually. It looks quite toothy, doesn't
Let
it?
me have a look before you pick it up.
Don't keep talking to me, sweetheart.
Nope.
No.
Just lie
We'll have
It
a
may
look.
well be underneath him.
Eh?
I'm going to say check on the ambulance.
No, well, it doesn't matter.
Yeah, just ETA for a crew, please, for this detail.
Now 1 minute later.
Yeah, Roger, that's all received.
He's clearly taken a whack. We can see from his face, can't we? That's why everything's a bit cloudy and foggy. What we'll do is we'll get him on the ambulance, and then it'll probably be a journey to hospital.
The DCA, or double crewed ambulance, arrives on scene.
So we'll get you nice and warm in the back of the ambulance,
Okay.
all right?
Where are we going?
Going to go to hospital. Now just go steady, because you went a bit wobbly, didn't you, before? Are you ready? Push, push, push. Hey. Good man. Right, I'm just going to take this coat off while we're stood up, all right? There you go, dude. Right, come and sit yourself on here. Swing your legs up. That's it, mate. There we are. That's all right, isn't it? Well, it was not very nice on the floor. Right, if you get him on.
Scott alerts Chesterfield Royal Hospital.
Okay, so he's a 10-year-old boy. Yeah, he was riding his bike, and he's been hit by a car. He didn't have a helmet on. He's got a facial injury. He's a bit amnesic of events. He will probably need a CT head. Thank you. Bye-bye.
Travelling by ambulance allows Mum Rachel to stay with Jack on the way to hospital.
All right. You feel sick?
Did a bit sicky. Okay.
Land paramedic Stefan prepares to administer some pain relief.
Have you ever had one of them, the like jelly in a packet things? It tastes nice.
Right, I'm going to squeeze this in your mouth, okay?
Just swallow it. Oh, no. Oh, no.
Hey.
No, you're not.
He had different ideas.
Okay, look, that's fine. We'll sort it.
See what dinner is?
Hmm.
He had a corned beef sandwich, but
I was going to say.
they don't really look like the corned beef sandwich, eh?
That smells like Vimto.
Have you had some Binta? Is it?
That's from his mouth, though, I think. Yeah.
Yeah.
When somebody is being sick after they hit their head, it is a particular warning sign, though, that there could be something more significant going on in his head.
Better out than in.
So we need to really get him to a hospital quickly so we can get a scan to have a look at this.
In case Jack deteriorates en route, Scott will travel with him on the 9-mile journey to hospital.
I'm sure they'll even put the sirens on for us.
Oh, really?
I'm more excited about that. He'll just want to snooze.
What's the music?
There he goes.
Right, yeah.
I know. He'll be okay.
Just this last couple of days. Just starting to go out on his bike.
He'll be distracted. That's all it will be. He'll be distracted for a moment.
Jack's mom is having the worst day of her life. And as a parent myself, I can empathise with where she's coming from. And actually, I want to ensure that I can reassure her and explain what we're doing and how we're going to make things better for her and her family.
Most important thing is all right.
They arrive at hospital within 17 minutes.
Right, Jack, so what we're going to do is we're just going to get you off the ambulance in a second. We'll go down the ramp. There'll be a few bangs and bumps. Good.
I'm here, baby.
There we go.
That's excited on you.
Jack will be given a CT scan of his head to establish if he has sustained any serious injuries.
Are you waiting first?
Yeah. Woo!
Yeah.
Cambridge City Airport, one of 2 bases for the East Anglian Air Ambulance, providing emergency care for patients in Norfolk, Suffolk, Cambridgeshire and Bedfordshire. The charity has attended over 30,000 missions since it was founded in 2000. It's the start of a new shift. The helicopter is loaded and ready to go, and pilot Matt Sandbach is leading the morning briefing.
UAV operating off the North Norfolk coast out to the wind farms.
Working with Matt, a paramedic Joe Dowsing, and Dr. Drew Welsh.
We've got our radio, you've got yours.
Yes, thank you.
Flight helmets.
Both got our own out there.
Carrying equipment.
Yes. Yeah, both on board.
There's a long list of tasks that we need to complete every shift, like checking equipment. We also need to keep our clinical knowledge and skills up to date.
I'll start when it gets to separate.
In this case, we're testing the Zoll monitor, which checks a number of physiological parameters. The monitor records SATs, which is short for saturation, and that's the amount of oxygen carried in the blood. And this is measured with a little finger probe. So it comes up as a percentage. 100% is when the blood is fully saturated with oxygen.
I can't get my SATs below 100. How awful. Oh well, worst thing could happen.
Between the 2 main medical bags, there's around about 150 different items of equipment. We have to know each one inside out.
It's an hour before the end of their shift.
Cambridge, go ahead.
Just for you, please, in Clacton, bit of a trek, I'm afraid. A 68-year-old male has fallen from a roof and is bleeding from the head.
Hospital? Yeah.
Matt and co-pilot Lee are plotting 50 miles southeast to the coastal town of Clacton.
It's going to be approximately 20 minutes. I'll give you an update when we're up to speed. We don't even know if he's conscious and breathing, do we?
Falls from heights can be very serious, but especially so in older people. We really have to think about injuries to the brain, injuries to the spinal cord, and other fractures.
Right, guys, the scene is just coming down the right-hand side. Have you seen it already? Not yet. Aircraft Wrangler 2 overhead scene, over.
As they approach a business park on the edge of town, the crew look for a landing site.
That parking area is closed, which is suboptimal. Does the bugger car park fence look low enough to... It looks pretty high.
It can be particularly challenging to find a landing site in a built-up area because we need somewhere which is big enough, which has access to it, it's flat enough and it's safe enough.
As they circle round, Matt spots a suitable site.
Okay, so it'll be down in this position here. Aircraft Wrangler 2 on the ground, over.
They've landed in an overgrown field 300 yards from the patient.
Keep left of here. Ooh, hang on a sec. It's a little bit sharp. Thank you. Oh, Lord. Keep left of here.
We're both wearing our flight suits, which are designed for safety, not comfort or flexibility, and we're probably carrying about 30 kilograms of equipment each.
With our super flexible trousers.
At this stage, we've got very little detail as to what's happened, so we really need to push on and get there.
Yeah. Oh, there you go. There he is. Hello, folks. Sorry to keep you waiting. How are you getting on? It did. We're from Cambridge.
So it appears that he's fallen down. There's a pool of blood just at the top of the stairs. And then the ladders themselves are right at the bottom of another flight of stairs.
Right. Okay.
There is some blood splattering down the stairs, so query that he has fallen down that set of stairs as well.
The patient, Martin, had been fixing a fan unit at his daughter's beauty salon when he fell.
I'm Drew, one of the air ambulance doctors. Do you remember what happened?
Up to a point, I don't remember falling, so I've got to be honest.
So you don't remember what caused you to fall, or whether you slipped, or whether you had a...
69 shouldn't be up a ladder.
So possibly you may have passed out, or fainted up the ladder, or blacked out, or...
I don't think so. I don't suffer from fainting.
You don't suffer from fainting or blackouts, no.
Martin's fall could have simply been an accident, but at the age of 69, we have to consider causes like a heart condition or a stroke that may have caused him to collapse.
Just so your right chest is hurting?
Right, yeah, right side.
So did you land on your right side?
I have no idea.
It sounds like you might have just gone down there. Does it hurt when you breathe in and out?
Yeah, just on the right side around.
Just the right side around there. Lift your arm up for me, if you can. You can't, that's fine.
No, can't do that.
There's a little bit of bruising around that part. How's that? That tender? Yeah, that is tender.
So far, we think that Martin has fractured his right collarbone, but the pain which he's experiencing on breathing suggests that he's fractured his ribs as well.
Lift your chin up.
No, lean back on me, Dad.
I'll just keep sat up just for a little bit longer if you can, just so I can examine you. Right, okay. You had some surgery on your left side of your neck.
Yeah, that's where they took out all the lymph nodes when I had the cancer.
Right, okay. There's a little bit of a graze there. And this arm's all right, is it?
Yeah.
And squeeze my fingers tight. Lovely. And you can wiggle your toes, move your feet. Fine, okay.
I've asked Martin to wiggle his toes just as part of our neurological assessment to check that the spinal cord's working properly.
I think we're all right to stand up to hop onto the trolley and get me in the ambulance.
Drew has ruled out spinal cord and lower limb injuries, so it's safe for Martin to be helped onto the trolley.
Yeah. Everyone ready?
Yep.
Ready, set, lift. Okay.
Oh, you're fine, I've got you.
It's all right. It's just my shoulder round the back of my shoulder. All right. Yeah. We'll just swing you around so that your head's on that little pillow that we've done. So swing your legs up this way. That's excellent. Well done.
Leaving Martin with the land crew, Drew wants to see where he fell.
Being able to look at the scene and understand the mechanism of injury gives us vital clues as to what injuries we can suspect.
So it looks as though, to me, he's been working up there.
Oh, I see.
And he's stood on, he's fallen through.
Yeah.
I think he's landed here.
Yes.
It appears that Martin's fallen through the ceiling tiles onto the landing below.
So feet first, and then he's clipped his head and shoulders on there.
I think so. It's a 10-foot fall.
Now I've seen the height from which Martin's fallen, I'm more concerned about internal injuries that are harder to detect.
I'm just going to have a little look.
Looking for damage to Martin's lungs, Drew will scan his chest with an ultrasound device.
Maybe loosen that one off for a second.
When a lung is punctured, it collapses and puts pressure on the other vital organs in the chest, impairing blood flow and oxygenation. If Martin has a significant pneumothorax or a punctured lung, we'd have to act immediately with a surgical procedure to release the pressure in the chest.
Have a little look at your lung.
I'm shivering now, boys.
Right, can you take a deep breath?
Connected to a smartphone, the ultrasound can provide images from up to 30 centimeters inside Martin's body.
Yeah. Sorry about this, Martin. This won't take long. We want to know as soon as possible whether or not he's got an injury to his lung.
No.
Just look once more at the front, just there.
The ultrasound machine is quite a handy bit of kit to have because it helps our decision-making process at the roadside.
I can see lungs sliding just there.
If we can see the lungs sliding up and down, it means that it's inflated.
Right, Dad.
No.
Oh, no, you're not.
Feel like I fell off a ladder.
Yeah, you've got good lung sliding there. So 1, 2, 3, 4, yeah. I'm happy with that.
Fortunately, the ultrasound does not indicate any serious damage to Martin's lungs.
Martin will now be transported by land ambulance to Colchester Hospital.
Watch your back. Right, some lever tape. So yeah, we scanned his chest. Can't see any pneumothorax. Obviously he's got a collarbone fracture there. Are you guys all right if we leave you to it? Awesome, mate. Thank you very much. Martin, all the best.
Thank you very much.
Hope you get out of hospital.
Sorry you had a wasted flight.
Martin is obviously quite a resilient and tough character. I think he's done very well to escape major injury.
Nice to get out. Take care, folks.
Take care.
We are happy to leave Martin in the capable hands of the ambulance crew. But it does mean we still have to get back over that fence and through that awful field to the helicopter before it gets dark.
Hashtag M5.
I just woke up quite early and I kind of sensed that I wasn't feeling very well. Then I was kind of discomfort, but I just thought, just a headache, migraine is coming. I felt my heart start going really fast. And when I'm saying fast, I kind of thought my heart had just come out of my chest. I was feeling helpless. I was feeling, this is it. I've got 2 young boys. my husband. We've got a family to look for, or life ahead of us. And is it gonna be the end? I wanted to talk to Dr. Zoffi about my children because that moment when he explained to me how serious I was, I kind of realized, am I gonna be able to see them again? And I just thought I needed to let him know that I'm a mom and I've got 2 young children. Would you like a cup of tea, guys?
I have a hot chocolate.
You want a hot chocolate? Okay. Family is everything to me. I grew up in Greece in a large family. And here now with my boys, my husband, is everything to me. The best thing I love doing is being a mom and a wife to my husband. Since it happened, I'm feeling better and better every day. Enjoy life more and more.
Dad's lost. Unlucky.
The future will hold great things. I'm looking forward to traveling, see the boys, going through the secondary school, hopefully go to uni. And eventually, one day, myself and Danny, we can retire and go back to Greece and have a wonderful time.
I think a cup of tea and a bite to eat, if we're lucky.
Yeah.
And then
ready to go.